To understand why VR is ideally equipped to help address the chronic pain epidemic in America, and it is an epidemic. There's over 100 million sufferers in the US, and we spend about $650 billion a year. And the question is why? Why do we spend so much trying to address it? And it's because we've been using an outdated care paradigm. Historically, we've treated chronic pain like it's acute pain, but chronic pain is fundamentally different. If you've been suffering through it from a long time, you a lot of times have comorbidities of depression, anxiety, catastrophization, sleeplessness, social isolation, and that becomes this vicious cycle. And if you're only trying to address the physiology of it, you're never going to fundamentally address and solve the challenge. But this is where you go into the second challenge in America. It's access to care. There's only one provider for, and depending upon your denominator, 50 to every 100,000 sufferers that are out there. So even if we wanted to get people the integrated pain treatment, we just don't have the capacity to deliver it today. And so that's where VR comes in, and we've been working with a woman named Dr. Beth Darnall out of Stanford, one of the leading pain psychologists in the world. The woman is absolutely incredible, and we've been developing this with her in concert, or in partnership, over the last probably 5 years by now. And this is this idea that what we need to do is we need to treat chronic pain holistically and address it from the cognitive behavioral therapy as a core component of what we're doing. And so what we've developed is an 8-week treatment that you're supposed to use once a day, every day, but it's only about 6 minutes a day for the patient. So it's not a lot of a lift for them to be able to use this. And what we're doing is we're teaching skills, how to actually self-regulate the body and the mind so that when you take the headset off and once you return it, you don't need the headset anymore, that we've taught you the skills how you can actually control yourself. We're big believers in using biodata to drive the actual experiences that you see inside the headset. So we actually created a derivative of this where we capture your breath with some patented technology. And you go into this one headset and there's a scene where it's essentially a desert scene and there's a decrepit tree in front of you. And as you start to breathe at the proper pace, you start to breathe life into the world around you. And you take this desert scene and you turn it into a beautiful meadow with a tree at the center of it that you've brought life to that tree. And it's amazing when you can actually see your own breath visualized and realized in the virtual world, and it gives you that sense of agency in your life that you can actually control these things, because a lot of pain sufferers feel like they don't have control in their life.